big question. If your wisdom teeth aren't hurting, should you leave them alone? Or are you setting yourself up for future pain or an expensive surgery? A lot of people think that wisdom teeth removal is just a must do when you hit your 20s, but the truth is that's not always the case. Today we're going deep into the myths, the facts, and the surprising reasons why some of you don't have to go through this process. Hi, my name is Mary, and on this channel we talk about dental health, braces, and keeping your smile happy and healthy. If you've been told that your wisdom teeth needed to be out, or you're just curious if they're really necessary to be pulled out, then keep watching. So, to start, let's talk about what exactly are wisdom teeth. Wisdom teeth are your third molars. They are the last teeth at the very back of your mouth, and most people have four wisdom teeth, two at the top and two at the bottom. And usually, these teeth erupt between ages 17 and 25. In ancient times, this is very essential because our ancestors' diet is kind of rough on teeth. So they eat raw meat, roots, nuts. So extra molars are very helpful with chewing. But over thousands of years, our diet softened and our jaws became smaller. And that is when the problem starts because the jaw became smaller, but we still have the same number of teeth. So, given all of this points out to the question of why do dentists often recommend for their removal? Dentists don't just recommend surgery just for fun, but there are real issues that come with the wisdom teeth. Number one is impaction. This is when the tooth is trapped underneath the gum or the bone. So the position of the tooth can be sideways and it can push into the tooth in front of it. Sometimes this can cause pain, swelling, or even cysts. Second is crowding. So if you already have a straight teeth and in at some point there is an erupting wisdom teeth, it can actually mess up the alignment of your teeth. And this is actually quite critical after your orthodontic treatment. Third is decay and gum disease. So, since our wisdom teeth are located at the very back of our mouth, it's quite difficult for us to reach them while we're cleaning. There are more chances that the food gets trapped and bacteria grows, which can also lead to gum disease and cavities. And the last one, which is the fourth one, is the recurring infection. So, there are cases that if the gums around the unerupted tooth gets inflamed, then there is a possibility for infections, and that can be extremely painful. When these issues are present, removing the tooth can prevent bigger problems down the line. Now, we already discussed the reasons why you might need to have your wisdom teeth removed. Now, moving on, we're going to dig into some situations why you might not need to have them extracted. Here's the part that most people don't hear. If your wisdom teeth are growing straight, they are fully erupted, meaning they're not underneath a gum, not crowding your other teeth, and can be reached by brushing or flossing, then you might not need to have a surgery at all. In fact, some dentists take the watch and wait approach. This is when they keep an eye on your wisdom teeth during your regular checkups, and they also get into some x rays that they make sure that there are no changes during the time that they're trying to assess if they should have your wisdom teeth extracted or not. I've even heard of people who are in their 40s and 50s who still have their wisdom teeth and they have zero issues. So, yes, it is possible to keep them until you get old. So, moving on, what are the risks of unnecessary removal? So, in my personal experience, I haven't really gotten into any risk, although I already have my two wisdom teeth at the bottom removed, and most probably in the coming weeks or maybe months, I also have my wisdom teeth at upper jaw be also removed. But anyway, we are just gonna talk about some of the risks that you might encounter, but probably there's a lower chance of it. Some of the risk might involve swelling or bruising, pain for several days, dry socket where a blood clot can come loose and might expose the bone, and very rare case nerve injury and also some sinus complications. So moving on, we think about when the removal is the smarter choice. That said, sometimes removal is a better option even if the teeth aren't causing any pain yet. Why? Because problems can occur suddenly and it's easier to recover from the surgery when you're younger. So, let's say if you're in your late teens or early 20s, it's easier to recover from the extraction rather than in your 30s or 40s. If your x ray shows that your wisdom teeth are growing towards the roots of the other teeth, pressing on nerves or creating pockets of bacteria, then it might be worth removing the wisdom teeth before anything gets worse. So, how do you decide if you have to have your wisdom teeth extracted? Number one is to get a thorough evaluation. So, you may ask for a panoramic photo or x-rays of your jaw and your teeth. So most of the time this is asked by your orthodontist or dentist when you have your assessment. Second is ask for any long-term risks, whether having them removed or not. Third is to consider your age and healing ability. And fourth is to get your second opinion, especially if you have no symptoms or aren't sure about the surgery. So, what's the takeaway of this video? Wisdom teeth removal aren't a one size fits all decision. For some, it is absolutely necessary to have their wisdom teeth removed, and for others, it can be avoidable as long as there is a proper dental care and monitoring. The key is making the decision with your dentist or your orthodontist, not just because everyone else does it. So, have you had your wisdom teeth removed or are you still keeping them? You might want to comment down below if you wanted to share your story. And if you find this video helpful, you might like the video and subscribe to the channel if you wanted to track the progress of my braces, because I give monthly updates of my braces adjustments. And also, if you want to watch this video talking about more braces, you can click this video here and my updates right here. I'll see you on my next video.